All right, if you've ever had back pain, mid back pain, from this area to this area, we call that the thoracic back. The common symptoms are perhaps if you take a deep breath in and it kind of bites right in there, or you turn and twist and you feel that pain, there's a good chance you have a pinched nerve.
And we're going to show you 5 easy options to help alleviate this pain that have a strong track record with some of our patients.
That's right, it's all right here. All right, I'd like to show you the likely causes of this pinched nerve or the pinched nerve-like pain you're experiencing. Number one, actually we're going to look at every level. There is actually a spinal nerve. Mike is pointing them out right there. Those nerves could be pinched from a number of reasons. We're not going to get into all of them. Another location of pain source could be the facet joints. And there's 2 facet joints between each vertebra. So you got 12 thoracic joints. That's 24 possibilities. And the next thing is where the rib actually connects to the transverse process, which is a bone that comes from the vertebra. And those should be mobile, but they lock up sometimes too, and we need to break those loose and mobilize them.
So, common reason for a pinched nerve in the thoracic spine area is often from prolonged sitting in poor posture like I am. When I'm rounded down like this, I'm putting a lot more pressure on all of those joints we just talked about and the discs. So getting in a correct straight posture can help alleviate some of those symptoms.
That's right. And also, if you're in this prolonged posture, driving in your chair watching TV, particularly driving like myself, and you hit a bumpy road on my lawnmower and you get this jolting going through your spine, terrible on a rounded spine. That can really set something off. I've been awakened in the middle of the night with pain, and we're going to show, and I've got a solution for it, and we're going to show you that as well. I think number 3 or 4 on that.
Well, let's get into that.
That's right. All right, the first exercise I like, a lot of people will like it. It's not real aggressive and it can do the job. We're going to show you 2 options. One is something you can just use some towels at home. The other one, you'll need a 36-inch long, 6-inch roll. You'll see what I'm talking about. Thank you, Mike. Now this, you need to take some towels and roll them up relatively tight, and then you tape them together. Don't worry, you'll use this, so just don't wash it. Don't take it apart and wash it. Just keep it for your back stretch. Set it down like this, so it's about 6 inches in diameter, and you're going to lie on this pretty much right between your shoulder. Oh, I just had my back pop. It cavitated. Feels good. And like Mike is helping me out, if you put pillows to rest your head, makes a significant comfort difference. Helpful comfort, whatever. Makes it more comfortable, and you can relax. You can bring your arms out like this and go up and down like this. My shoulders right here, I feel a stretch. And if I wanted more stretch, I would put 2 weights in my hands, probably 1-pound dumbbells or simply a can of soup. Make sure you do it on both sides. And that really offers a better stretch on my spine and back as well as my pec major muscles. You're going to hang out here 15 to 30 seconds. You can relax and repeat that. Again, if this creates pain, any sharp pain, it's not right for you. Okay, now if you happen to have a 6-inch foam roller, they work very well. A little more challenging in a way. Make sure you get the one that's soft density. Medium works well, I like. You could use the more firm one if you want. It's just not as comfortable. Now with this, you need to put it on your sacrum, that bone right below your belt line, and then right down so the roller's between your shoulder blades, and you rest your head right on the roller yourself. Now, if your head does not touch because you have a tight neck, that may be normal. You want to get a pillow, which is right here, and put that there for comfort so you can relax. And you do exactly the same thing. This you can kind of roll back and forth. It can help, if you want to stretch one leg up here just because you want something to do, you can do that with the towel roll as well. Use the weights, just as I mentioned with the towel roll. It's the same thing, except for you have your foam roller. I personally find great deal of comfort in my sacrum and my SI joints using this, so I'm getting more than one area. it's a bonus.
So stretch number 2 is going to work on your amount of thoracic extension, or how far you can bring your back backwards. Again, you will need a thick roll, 6-inch roll like this, or a foam roller. We'll show both variations. I'm going to place this where it feels comfortable for me personally. Again, you can use a pillow under your head for some nice support, supporting the head there. And you're going to see what feels comfortable. If I go up here more, I feel a lot more lumbar extension here. That's not as comfortable. I want to hit that mid-thoracic back area. So I'm going to go in a range that feels good. Lay here. You can bring your arms out to your side if you want, or keep them in. It's just working on bringing that extension back in your spine.
That's right, and this, you will oftentimes get that cavitation or that crack release. You'll feel that, or even hear it. Again, we're going to show with the foam roller. It's a wonderful stretch. This is one of my go-tos.
So for this one, I'm just kind of sitting in a spot for 10, 30 seconds, and then I might kind of roll up and just get a new spot. Just kind of work through and see what feels good.
That's right.
Okay, now we're going to do the same thing, but with a foam roller. So for this, you're actually going to roll. So I'm going to lift my buttock off the ground. And I'm going to kind of roll that thoracic spine region, roughly to my shoulder blades, to my mid-back around here. I don't like it. Once you start getting into lumbar spine, you will feel it. If you're getting some headaches or neck discomfort with this, you can put a towel behind your head here and pull up with your hands to give it some support if you're having some neck pain with this. But this is another way you can just kind of roll into it. You can also do what I did before and just kind of lay over it and work on that thoracic extension. Hi, Brad.
How you doing? Yeah, and actually, if you don't have the towel and you have really flexible arms, you can simply do that. It gets a stretch into the shoulders and the pecs as well. It's a wonderful, wonderful stretch. Okay, this next stretch, you're actually going to need a special tool. It's called the Bob and Brad Posture Pad. We developed this specifically for the thoracic spine, for the pinched nerves, as well as helping with that hunchback or that neck hump from head forward posture that people get stuck in after they've been this way for a number of years. I'll show you how you use it. It's got a nice radius here, which is there for a specific reason. These tennis balls are in there for a specific reason. But first, you simply go like this, and you lie on it there, and you, did you hear that?
No.
It was there. I definitely heard I'm at about T7 right now. I'm going to start low, and I'm going to work, and you can rock back and forth, and you'll find the area that needs the stretch. As you can see, I'm supporting my head. You can also take a towel and hold it across your head if that's more comfortable, which actually I always like to do that one way or another. And I'm going to work it. Now, once you find a spot that really needs the stretch, you're going to hang out there for 15 to 30 seconds or longer, whatever you would like. It feels great. It's nice when you can get to that one spot in the corner of the posture pad. Now, if you have tight muscles between your shoulder blades, that's the reason we have these tennis balls in. And they're not just any tennis ball. Where'd that one go? There it is. The light blue ones have less pressure, and the other blue ones have more pressure, and all of them have less pressure than a regular tennis ball. But we're going to put those in there, and you put them in wherever you would want. I'm going to put the ones with the lower pressure on the top here. Now, this is a little more aggressive. You may take a towel and go over it, and that's going to go into the knots of the muscle belly between your spine and your shoulder blade on each side, and you will feel it. And what I like to do on this is I like to actually go forward and backwards when I hit that trigger point. The left ball on the top is actually on a trigger point right now. I'm feeling it, I'm working it. And as I do this, it's much more comfortable. The trigger point, the muscle is releasing and relaxing, and that's the point with that. Now, Bob uses this on a regular basis, right, Bob? And you actually are in a position like this. After you feel, I want to get more aggressive on those trigger points, well, that one I want to get more aggressive, so I'm going to put the blue ball up there, leave that one out, take all of them out. Now I'm going to put all the pressure right there on that tight spot. This is just an option, and that makes a fairly significant difference. And I'm going to work over that. And sometimes that pain is not a pinched nerve. It may be just a knot that is so tight and that muscle is so bound up, it's really burning away and causing pain, and this can get rid of it. So the posture pad, you go to bobandbrad.com and you can order one of these if you'd like to. Otherwise, we got the other options that we've already talked about.
So this option, again, we're going to work on straightening that spine and fighting against that rounded posture we're in most of the day. So you can do this at a chair at home or maybe your work desk. You can use a ball for a little bit more stretch. You can use a smaller one or larger one, whatever you got available. So I'm going to put this behind my back in a position that feels good. Kind of going to go mid back here, and then I'm going to lean back into it. And if you have good shoulders, you can lean back into it and then bring your arms up as well. Really opens up everything in the front and gets that spine extending, combating that flexed forward posture we talked about earlier.
I do want to mention the ball they use, like Mike said, different sizes, but it really needs to be a soft, squishy ball. If it's for example, I'm extreme, but a basketball would not work or anything. Even a soccer ball is too hard. You need a squishy ball. So if you don't have one, go to the neighbors and see if you can get one from the neighbor kids, and then bring it back, of course.
Do you ever just keep it?
No, I do want to mention, Mike, we believe, is the originator of this exercise. How many years ago? You were working with patients and showing them this like 10 years ago, wasn't it?
I don't know. I don't remember. It's too long ago.
Well,
So you can do this stretch throughout the day. You can do repetitions. Say you want to do 10 repetitions, and you can hold it for 5 to 10 seconds each time. If you'd rather just sit here and hold it for 30 seconds to a minute, that's perfectly fine as well, and just do it throughout the day. The whole idea is, if you're sitting like this most of the day, take frequent breaks to go and bend your spine the other direction.
most excellent. Thank you so much.
So number 5, if you're having referral pain all the way down your arm and into your fingertips, it may be referral pain coming from the low part of your neck, and Brad is going to show an excellent option for that.
Right, we're getting out of the lane of the video, but it's so closely related to thoracic or mid-back pain, we're going to address it anyways. So the pain down the arm can be simply numbness, tingling, feeling cold. It's a pinched nerve at the low neck, upper back, and one way you can try to alleviate this, sit up tall as you can and simply do chin tucks. So you bring your chin in towards your throat like this. Breathe and relax and see how the pain or the numbness and symptoms in the arm respond. If you do this 5 to 10 times and the symptoms in the hand or the forearm seem to be improving, it's gold. You're going to have progress with this. You may want to put a little overpressure. On the other hand, if the pain, numbness, tingling down in the arm and you do this and it makes it worse, then you need to stop right there. Now, the next option, if this is getting better, then you can try add to neck extension. You take a towel roll and you roll it up like this any way you want, so we have some cushion and support on the low neck. Use a firm chair, scoot your bottom back in the chair. Start with a gentle chin tuck. Support here, not pulling hard, just support, and look up, and you can bring your hands up like this to offer a little traction, or you can keep them down. And what we're looking for is if you do this and it hurts a little bit, come forward, repeat that a few repetitions. And if it starts to feel better, or the pain and the numbness down in the arm and hand are improving, then it's a green light. You continue up to 10 repetitions. And if it feels better in the arm after that, you take a break, come back in an hour, and do the same thing. And you're going to do that every hour as long as symptoms in the arm and the hand improve and are moving upwards towards the shoulder and the neck. And eventually your range of motion, less pain, everything will improve. And you'll start to go back in a normal supported way until the arm pain, that pinched nerve, is then released. It's a little more complicated, so take your time with this one. If it doesn't make the arm better, you stop. It's very clear on that. Yeah, that camera thing, I always get mixed up. We're pointing over here. Anyways, we're done with this. This can be an excellent option if it works, but only then. Mike, do you have a finishing outro?
I would say pick which exercise worked for you. Obviously, it's 5. They take a lot of time. Try them all and see what works, and stick to that one for a while to see if it helps.
That's right. Easiest ones are first. The harder ones are a little bit later in the video. So now they're tired of us, and we're tired of doing this.
And we're rambling and a little sweaty. So
Take care. Have a good day. We got to get some lunch.